Thank you, Brian. And now for the Democratic rebuttal.
There are a few things that need to be addressed when discussing the increase of Medicare, especially in regards to senior citizens. Looking at the $60 billion money-saving figure, so far already $80 in the plan has been negotiated through negotiating with prescription drug companies. One thing to start looking at is what Obama refers to as closing the donut hole. For the first, as of a Medicare Part D bill passed under George Bush, the first $2,700 is covered by the government, and then that stops. So after that, the government at this point has no legal right in any way to negotiate with prescription drug companies, and until up to $6,100 in medication spending by those senior citizens is met, there is no coverage. They are submitted to a $50 pill problem that we're looking at right now in the U.S. So on top of that, one way that Medicare will save is through efficiency. And part of that is breaking down state barriers in health insurance, but that, first of all, there will be no rationing of health care. Senior citizens will be able to use a private option as well as the Medicare option as they are able to now. Now, those using the Medicare option will see an increase in efficiency through record sharing under the Obama plan. Now, the Obama plan is not a bill. It is a plan put forward by him through his speeches and through his plan in the primary. So, lot overhead will decrease. Savings will increase. Essentially, Medicare could, in the long term, pay for itself.
Thank you, Ben. We're going to now focus question 4, which will be responded to first by the Democrats. We're going to focus on non-United States citizens and how they will be affected by health care reform. So, to the Democrats, how does your party address non-United States citizens in their approach to health care reform?
Thank you. This is probably the most prevailing and worst rumor I saw this summer, was that in some way the Democratic health reform package is code for we are going to cover people who are here undocumented. That's simply not the case. If you look at 3200, which is kind of the main bill going forward, there's a lot of plans out there, but 3200 looks like it is the main package the Democrats are putting forward. There's really not much mention of undocumented workers to begin with in the bill. I know there's been chain letters sent out. I know there were speeches made by Republican senators that said there is wording in the bill that would either open the possibility or has the standard that we are going to cover people who are here undocumented. That's simply not the case. That's been debunked by factcheck.org, politicalfact.com, nearly every bipartisan fact-check site on the web. There's a few minute details that you have to get in when you're talking about people here undocumented. First of all, we have a long-standing tradition in this country that if somebody shows up at an emergency room, they don't have to show their Social Security card to get treatment. We're going to treat anyone no matter what their status is, and because we're talking about emergency care. We're not going to let somebody die because they didn't come here the proper way. That doesn't change under 3200, and I don't see how it should or why it should. You also get into, when you're talking about 3200, is Medicaid. Right now, Medicaid does not cover people who are undocumented. You have to produce records that you are here legally. That would not change under 3200. The same fail-safes would remain in place. The last mention would be the only time that any of these websites that I looked at actually found a mention of people who are here undocumented was in 3200, page 132, section 242. And what that is talking about is if you create a public option and you create this national insurance pool, which the Democrats have proposed, people will get what they call availability credits on the basis of income. So if I am below 400% of the federal poverty line, I am able to get these credits to then go out and buy insurance. 3200 specifically states that these credits will not go to people who are here undocumented. So any claim made by the Republicans that in some way the Democratic bill is going to cover people here illegally is an unfounded and baseless claim.
Republican side, how would you respond to those arguments?
Well, Mr. Elliman, there's a lot of things that you said that we agree with you on. But one of the things that I'd just like to mention is that we leave a lot some time for them to rebut. respond to this?
I believe we could
Okay,
pull
if I
out
keep
30
it short,
seconds.
right? Yeah,
Yes.
okay. All right, well, my question to you is that there's nothing in the bill that would sponsor illegal immigrants receiving health insurance, then why, when Paul Ryan tried to bring about the amendment that would give distinct definition to not allowing illegal immigrants to receive health insurance from a public option, it was crushed by the Democrats. It was not passed as part of the bill.
Well, because then you get into how do you enforce that? The National Insurance Exchange would be onto a statewide basis, so that New York State would control their pool of the National Health Insurance Exchange. How do you have in a bill, and the amendment didn't specify this to my knowledge, the amendment that came forward, how do you specify how New York is going to check who's here legally and not? I mean, we have a serious problem with that. And it would be up to New York State to do that, and they already do that when you're talking about things like Medicaid and Medicare. They already have fail-safe in place, and that wouldn't change. New York would still be able to verify who's here legally.
All right, thanks, Mike. Francis, 30 more seconds to respond if you wanted to. Okay, thank you. All right, well, our second to last question will go to the Republicans, and it will focus on a highly debated topic and was derived from a July 2009 Time magazine article entitled, "Could Abortion Sink Healthcare Reform?" In this article, author Karen Tumulty raises the question, should government subsidize healthcare, pay for abortion procedures? Republicans, what is your party's stance on this question?
Well, obviously the official Republican stance is that the government should not subsidize any form of abortion unless it includes rape, incest, or the mother's life is in danger. So there's a couple things that I'm worried about on this topic. One, Obama, or the president, has been very ambiguous when it comes to describing this subject, because he went forth to the American public and the Congress in September and said, absolutely will there be no federal funding for abortion. It's pretty clear about that. However, to Planned Parenthood during his campaign, he said, in my mind, reproductive care, which includes abortion, is essential care and would be covered by public insurance. He said that. He also said that private plans which provide for abortions will also get federal subsidies. So it's really not making sense where he can go to the American public and say abortions will not be included in the federal funding or in terms of health care, yet these statements that he's making, including the actions of some of his party, like Representative Waxman, who helped the Capps-Waxman Amendment get it passed, specifically allows for federal funding for abortion. So with the actions of his own party and the Senate Finance Committee rejecting a conscience rights amendment, which had been accepted by the House Energy and Commerce Committee, to me it seems like he's not being very truthful to the American people when he claims that federal funding will not go towards abortions.
Thank you, Brian. The Democratic side, Mike.